Hello, I'm Donal Macaulay from BJGP. Today I'm talking to Professor Azeem Majeed, who's one of our top primary care epidemiologists based at Imperial College. Azeem, tell me a little bit about the epidemiology and how the figures are changing from day to day with COVID-19.
Thank you, Donal. So the positive news since we last spoke is that the doubling rate has slowed down. The number of cases was doubling in the UK about every 2.7 days. That's now slowed to about every 3.7 days.
There appear to be some hotspots, principally around London. Has it spread to the rest of the country yet?
So it is now spreading elsewhere. So London was probably one of the worst affected areas, but we're now seeing also a lot of cases in other urban areas. So places like Manchester, part of South Wales. So it is spreading beyond London.
Most of our audience today are in general practice. Do we have any figures from general practice, or how soon will we have data from general practice?
At the moment, we don't have any data really, because there is a lag between data going in and data coming out for research studies. So there's no data coming out from research databases. I think locally in various parts of the UK, people are trying to work with their GPs to get live data from their systems, because the model we have at the moment, whereby the data goes to a research database, that's really too slow for health planning and surveillance. And it's a good point, because so far the data is largely come from hospitals across the world, but we need data from primary care as well to look at the epidemiology and outcomes.
It's very interesting because workload in general practice has changed dramatically. There'll be some very interesting data on how general practice has evolved through COVID-19.
That's right, Donald. So we've seen a dramatic shift towards telephone and video consultations. So in the past, those formed a very small part of GP workload. But now in my practice, for example, the bulk of our work is done by telephone or video. So that's one striking thing. We're also seeing some unintended effects as well. So unfortunately, many people are reluctant now to come to their doctor. But we can't forget that people will have other health problems. They need their vaccinations. They need their long-term health problems managed, their diabetes, their asthma, their chronic lung disease, etc.
Within the UK, the recommendation is for people over 70 to stay indoors. Surely that must have some impact on their health.
In effect, we're now in a kind of large social experiment, something that's never happened before in the UK or elsewhere in the world, where older people are being asked to confine themselves largely to their homes. That's not good for people. If you're in your home, you aren't seeing your friends, your relatives, you aren't getting much exercise. There is a risk that both your mental health and your physical health will suffer in that period. So it's very important that people remain socially engaged with their friends and relatives via telephone or by video call, and also get regular exercise as well. And finally, that they don't forget their health problems and do seek advice for their long-term health conditions. So if you're diabetic, if you're hypertensive, if you're asthmatic, make sure those problems are still being well looked after.
We've created this age threshold at 70 years old. How valid is that? And is that the same threshold that's used in other countries?
Well, that's a good question, Donald. So in the UK, the government's gone for a threshold of 70 for people to self-isolate unless they've got some other long-term health problem. But in many countries, the age cutoff is 60. There is a high death rate amongst people over 60 and high complication rates, so high number of pneumonias, admission to hospitals, intensive care, etc. So my advice would be, if you're over 60, take extra precautions and don't just follow the government advice of doing it from 70 onwards.
That's not very good news for people like me, I'm afraid, Azeem.
No, all people like me are approaching 60, so it's not great.
Today I've been talking to Professor Azeem Majeed. Azeem, thank you very much indeed.
Thank you, Donald, for your time. Thank you very much.